Hello, my name is Carrie Oliver, and today I'll be presenting on Institutionalizing Knowledge in a Rapidly Growing Organization, which covers knowledge sharing at Georgia Health Policy Center. This presentation was created in collaboration with Shoshoi Patterson, who also works at Georgia Health Policy Center. So the problem that we were looking to address with our systems modeling was the recent expansion in Georgia Health Policy scope as well as its size. In its 25 years of existence, Georgia Health Policy Center has grown to work in over 220 domestic and international communities. We have also expanded to providing 8 services, and our services include systems thinking, research and evaluation, as well as meeting facilitation in 9 areas of expertise. And some of these expertise areas include long-term services and support, behavioral health, as well as population and global health. In the recent 5 years, GHPC staff has doubled. As you can imagine, with this growth in staff, there's a growth in expertise as well as an exponential growth in knowledge that the organization can obtain. So essentially, our model was looking at how can we ensure that there is effective knowledge sharing across staff, considering that there is going to be a large onboarding of new staff, and we want those interactions with our more established staff members and our newer staff to be effective in ensuring that GHPC's historical knowledge is carried along with this expanded knowledge and scope. Effective knowledge sharing is important because it can lead to organizational innovation. Given that GHPC has a wide range of partners and works in a wide range of communities, it's important that we always keep innovation at the forefront of all of our work. Secondly, we wanted to ensure that effective knowledge sharing was in place to make sure that we were allocating resources across our staff, our projects, as well as with our partners. As you can imagine, with the onboarding of staff, we not only want to obtain new staff, but also retain staff over extended periods of time. Effective knowledge sharing has been shown to be connected to employee satisfaction. And lastly, given the COVID-19 pandemic and the transition to working in a remote and virtual setting, it's important that we not only look at our processes for knowledge sharing in the in-person setting, but also look at unique opportunities to make it more effective in the remote setting. So our approach for this systems modeling was twofold. Initially, Shoshoi and myself worked along with some thought partners across the center who have expertise in systems thinking and systems modeling to develop a draft of the model. And our draft focused on the 3 phases of knowledge acquisition and sharing. So those include staff knowledge transfer. So how do staff members share knowledge with each other? Knowledge awareness. So how do staff members become aware that certain staff have an expertise in a certain area of work? And then lastly, institutional knowledge. So how can we ensure that knowledge doesn't live with individual staff, but instead are shared by the center as a collective or as a whole? We were looking to engage staff to inform the model. So the model draft was taken around to meetings of different teams across the center. That gave us the opportunity to really recognize the variations across the teams, the different cultures across the teams, and we really wanted to dig into the processes within our model. So when we talk about knowledge transfer, not only who is doing it, but how is it done? What processes are we using for that? So that actually sharing across the teams allowed us to identify those variations. It also gave us an opportunity to identify where we could standardize some of these processes. So if we're all doing the same thing but in different ways, how can we ensure that there is not a way that one team does it or another team, but instead a way that the center does it as a whole? And lastly, because we've had such an influx of staff who have been onboarded during this virtual setting, we recognize that there were some processes that we may need to modify in this remote workspace. So how do we make sure that knowledge sharing is still effective, even if we're not in person in the office, and as we continue to transition to what our new norm of work environment may be? So by taking our draft around to the different teams across the center, we were able to get some really great feedback. The first of which being that the model was reflective of staff experience, which we were hopeful of and which we were able to achieve. We also noted that staff hired in the remote setting highlighted some differences in how knowledge was transferred. So essentially those working in person were used to going to the office or sending an email, but those in the virtual setting had to maybe work a little bit harder. We were also able to identify some processes that could definitely be streamlined across the center. Moving forward, we hope to refine our model further as well as collect data and metrics to test the model. We'd be appreciative of any guidance or best practices on developing a model measuring more of this intangible aspect of knowledge, as well as any metrics that we can consider to best assess the institutional knowledge across the center. Thank you so much, and we look forward to your feedback, comments, and questions.